Imagine losing like 30% of your skin's structural collagen in just 5 years.
Oh, wow. Yeah, that is a massive drop.
Right. I mean, if that rapid structural collapse happened to your face, it would be, front page news. There would be thousands of products marketed for it, and we'd talk about it constantly.
Absolutely, it would be everywhere.
But it's actually happening to millions of women in a place almost no one talks about, the vulva.
Yeah, it's a profound physiological shift. I mean, we see this massive acceleration of tissue breakdown, yet, because it happens out of sight, it just remains completely shrouded in silence.
Which is exactly why we're pulling it out of the shadows today. So welcome to the deep dive.
It's so great to be diving into this. We tend to treat these changes as if they're, I don't know, a reflection of poor aging rather than a documented biological process.
Yeah, totally. And our mission today is to decode exactly how a drop in estrogen during perimenopause accelerates the breakdown of dermal elastin and how that specific shift causes the literal deflation of the labia majora.
Right, because my goal here is to really establish the why behind these changes. Understanding the actual structural biology is the very first step to destigmatizing it.
Exactly. When you understand the machinery, you stop blaming yourself for how it operates. So let's unpack this. I've been poring over these histological studies, and the cellular mechanisms are just fascinating.
They really are, and we're going to break it all down together so it makes perfect sense.
So to understand how things fall apart, I feel like we really need to understand what was holding them together in the first place.
Yeah, you have to look at the baseline.
So let's zoom all the way in. Looking at the tissues during the reproductive years, we know circulating estrogen levels are high, but how does that hormone actually interact with the skin at a cellular level?
Well, the hormone doesn't just, float around aimlessly. It acts like a key looking for very specific locks in the tissue.
Okay.
Yeah, these locks are nuclear receptors. Specifically, there are two main types, ER alpha and ER beta.
Right. I noticed those receptors mentioned constantly in the sources. Do they live in a specific part of the skin? Or?
Actually, they're expressed everywhere. You find them in the fibroblasts, which are, the fundamental cells that build your connective tissue.
Oh, okay.
You also find them in the keratinocytes of the epidermis, which form the outer barrier of the skin. They even sit right in the sebaceous glands and the hair follicles.
Wow, so they really are everywhere. The sources actually referred to estrogen as this master gardener for the tissues. How does it actually perform that role?
By just constantly sending biological instructions, when estrogen binds to those receptors in the fibroblasts, it triggers gene transcription.
Meaning it tells the cells what to do.
Exactly. It literally tells the cell to manufacture collagen and elastin, which, maintains the thickness and the stretchiness of the tissue.
That makes sense.
It also signals the local blood vessels to maintain optimal blood flow, bringing oxygen and nutrients to the area.
There was also a mention of something called acid mucopolysaccharides, which is quite a mouthful.
Yeah, it's a very long, fancy scientific term.
Right. The sources say estrogen promotes them, along with hyaluronic acid, to keep the tissues plump. But what exactly is an acid mucopolysaccharide?
It's basically just a type of gel-like sugar molecule. These molecules sit between your cells and act like microscopic sponges.
Sponges. Okay, I can picture
Yeah,
those.
they attract and trap water. So when estrogen tells your body to produce more of them, the tissue stays incredibly hydrated, thick, and moist.
Let me try to visualize this for you listening. Imagine estrogen as a dedicated maintenance crew working 24/7 on a luxury building.
I like that.
Right. So for years, they've been constantly patching the drywall. That's your collagen. They're routinely fixing the plumbing to keep the blood flow strong. And they're just constantly pumping up those gel-like sponges in the walls to keep everything insulated and plump.
That paints a really clear picture of the baseline environment. The building is in pristine condition. But as you transition into perimenopause and menopause, something dramatic happens to that crew.
You laid off.
Pretty much. Circulating estrogen levels don't just dip slightly, they undergo a drastic withdrawal. I mean, we're looking at a 65 to 80% decline.
Wow. So 80% of the maintenance crew is suddenly just fired.
Exactly.
The drywall stops getting patched, and the plumbing starts to degrade. But looking at the clinical data, it seems like the body doesn't just slowly pause. It actively starts tearing things down.
Yeah, the structural integrity of the skin degrades at an astonishing rate. Clinical data shows that staggering 30% loss of dermal collagen in just the first 5 years post-menopause.
30% in 5 years. That's wild.
And it continues at a rate of about 2% per year after that.
I was looking at the data regarding elastin, too, which is the protein giving skin its bounce.
Mm.
There's this group of enzymes called matrix metalloproteinases, or MMPs.
Right, the
From
MMPs.
what I can tell, they just suddenly wake up and start destroying elastin. Why does the body suddenly turn on itself like that?
It really comes down to a loss of biological balance. Your body always has this, delicate balance between building up and breaking down.
Okay.
When estrogen levels plummet, the environment shifts, elevating the activity of those MMPs. There's one specific enzyme in this family called MMP12, also known as macrophage metalloelastase.
Metalloelastase. I mean, the name literally sounds like it eats elastin.
It basically does. Its primary function is to degrade both soluble and insoluble elastin. In a healthy, estrogen-rich environment, your body has a natural braking system for these destructive enzymes.
Like actual breaks.
Yeah, they're called TIMPs, tissue inhibitors of metalloproteinases.
Oh, got it. So the maintenance crew usually keeps the demolition guys in check by deploying those TIMPs.
Exactly. But the drop in estrogen means those TIMP levels are severely diminished. The brakes are completely removed.
Oh, no.
And to compound the damage, estrogen normally increases a signaling protein called transforming growth factor beta, or TGF-beta, which stimulates new elastin production.
So without estrogen, TGF-beta signaling drops, shutting down the elastin factory entirely.
You got it.
And at the exact same time, the uninhibited MMP12 is rapidly chewing up whatever elastin is left in the matrix.
Right, so the demolition crew is working overtime, and the supply chain for new materials has completely dried up.
Okay, wait, I have to push back here for a second. Because as I was reading through the stack of research, I found a really fascinating contradiction.
Oh, what did you find?
Well, we've been saying that estrogen acts as the master gardener and builds elastin. But there was one clinical study that took vaginal smooth muscle cells, incubated them with estradiol, and found that the estrogen actually inhibited elastin production.
Yes.
It decreased it down to like 67% of the control group. Why would estrogen destroy elastin in that scenario?
That points to one of the most crucial concepts in biology, which is tissue specificity. You have to look closely at which neighborhood of cells the researchers were studying.
Well, they were looking at vaginal smooth muscle cells.
Exactly. And in the deeper smooth muscle layer of the vaginal wall, the body has completely different priorities than it does on the surface skin.
Really? How so?
The study showed that estradiol significantly increased cell proliferation in the muscle up to 153%. But it deliberately decreased elastin production by inhibiting that TGF-beta one we just talked about.
Oh, wow.
Yeah, this might actually play a role in why systemic estrogen can sometimes worsen stress urinary incontinence, as the muscle becomes less elastic and more rigid.
So the muscle acts completely differently than the skin.
Completely. When we talk about the labia majora and the external vulvar tissue, we're dealing with dermal fibroblasts, the skin cells. And in dermal fibroblasts, estrogen absolutely stimulates elastin synthesis.
That's crazy to think about. The exact same hormone gives completely contradictory instructions depending on which lock it's putting its key into.
It is wild. And to take that a step further, another study looking at engineered dermal substitutes uncovered an even deeper layer of complexity.
Okay, I'm listening.
They found that estradiol stimulates elastin synthesis, specifically in female human dermal fibroblasts, but it had no initial effect on male dermal fibroblasts.
Wait, really? The male skin cells just ignored the estrogen?
They completely ignored it. They didn't produce any elastin, which obviously raised a massive question about the underlying signaling pathways.
I bet.
So the researchers dug deeper and found that female cells naturally maintained a constant level of a signaling molecule called CANMP cyclic adenosine monophosphate.
Okay, KMP.
Right. When male cells were exposed to estrogen, they experienced a sudden spike in CANMP, but still no elastin production.
Did they figure out why that was happening?
They did. They manually added extra CANP into the culture medium along with the hormones, and suddenly the sex difference was completely eliminated.
Oh, wow.
Yeah, elastin synthesis doubled in both the male and the female dermal substitutes.
So CAMP is like a hidden cellular key required to make the estrogen actually work to build elastin.
Exactly. It just proves how intricate these pathways are. It's this incredibly complex cascade of signals.
So for anyone navigating menopause, I guess the key takeaway is that in the female dermal skin of the vulva, the sudden withdrawal of estrogen definitively shuts down the elastin factory and unleashes that MMP12 demolition crew.
That is the crucial takeaway, yes.
Okay, so we have this runaway demolition crew destroying the scaffolding at a microscopic level. The collagen is gone, the elastin is getting chewed up, the maintenance crew is fired.
Right.
But how does this cellular demolition actually manifest anatomically? Uh, Because, I mean, it doesn't just stay invisible.
No, it doesn't. It drastically alters the physical structure of the labia majora and minora. Clinicians categorize this massive biological shift under the umbrella of genitourinary syndrome of menopause, or GSM.
Okay, let's focus on the labia majora first, the outer lips.
Yeah.
The clinical sources use the word deflation, which is a very vivid structural term.
Yeah.
Why does it physically deflate?
Well, the tissue suffers from lipoatrophy. The labia majora are heavily composed of adipose tissue, which are basically just fat pads. And the adipocytes, the fat cells themselves in the genital area, possess estrogen receptors. They literally rely on estrogen signaling to maintain their volume.
So when the estrogen drops, the fat cells are biologically programmed to just shrink.
They shrink, or the fat is entirely reabsorbed by the body. You lose all that internal volume. And simultaneously, the outer skin covering those fat pads is losing its collagen and elastin due to those MMP enzymes.
It kind of makes me think of an old leather couch.
A leather couch.
Yeah, like the fat pads are the internal foam stuffing giving the cushions their shape and volume, and the elastin is the tight leather holding everything together on the outside.
Oh, I see what you mean.
So when estrogen drops, you're not just losing the foam stuffing inside, the leather on the outside is fraying and stretching out at the exact same time.
That analogy captures the dual nature of the breakdown perfectly. You lose the structural cushioning and the skin tension concurrently, and the result is a flatter, sagging, wrinkled appearance.
And how does this mechanism affect the labia minora, the inner lips?
Hmm.
Because they don't have those large fat pads, do they?
No, they don't have the adipose tissue, but they are incredibly sensitive to estrogen withdrawal. Without the hormone stimulating the fibroblasts, the tissue undergoes severe thinning and retraction.
They shrink too.
Yeah, they lose their plumpness. Many patients report that their inner labia seem to physically recede or just entirely disappear behind the outer labia.
That's intense. Sources also mention that in severe untreated cases, you can even experience labial adhesion, where the tissues actually fuse together.
Yes. The epithelial layer becomes so thin, dry, and fragile without those acid mucopolysaccharides trapping moisture that even minor everyday friction can cause microtears.
Ouch.
And as the body attempts to heal those raw surfaces, they can inadvertently adhere to one another.
Gosh. And it's not just the physical shape changing, right? The visual texture and color shift dramatically too.
Think back to the maintenance crew fixing the plumbing. Without estrogen signaling the blood vessels, local blood flow to the entire vulvar region decreases significantly.
Right. Less plumbing.
Exactly. Less blood flow means less oxygen and fewer nutrients reaching the surface tissues.
One of the articles described the visual result as looking like a watercolor painting that's been diluted.
Mm-hmm.
The rich pigmentation fades, and the tissue just becomes pale and fragile.
It's a very apt description.
I really want to emphasize this for you listening right now. Experiencing these changes has an immense psychological impact. Many women feel like their bodies are failing them, or they attribute it to a lack of hygiene, or to simply failing to, age gracefully.
Which is completely false.
Exactly. This is strictly a structural chemical withdrawal. It is the literal biological removal of the scaffolding holding your tissues together.
Recognizing it as a physiological mechanism driven entirely by MMPs, TIMPs, and receptor activity removes the shame. It allows us to view the changes objectively as a mechanical issue that can potentially be addressed.
Speaking of addressing it, does the body have a backup plan, or do we have to manually intervene to rebuild that scaffolding? Let's transition into the actual interventions.
Let's do it.
What does the clinical data say about stopping or reversing this deflation?
Well, the clinical consensus begins by identifying what cannot rebuild the tissue.
Okay. You mean the over-the-counter aisle, lubricants and moisturizers.
Right. Those products serve a vital purpose in providing temporary comfort and reducing the friction that causes microtears, but they do not contain hormones.
So they're just a Band-Aid.
Pretty much. They cannot bind to the ER-alpha or ER-beta nuclear receptors. Consequently, they can't signal the fibroblasts to produce collagen or elastin, nor can they reverse the atrophy or the deflation of the fat pads.
So to actually rebuild the biological mattress, you have to hire back the maintenance crew. You need targeted prescription topical estrogens.
Exactly. Prescription topical estrogens, typically formulations like 0.3% estriol or 0.01% estradiol creams, are considered the clinical gold standard for reversing these tissue changes.
I was really struck by how localized this treatment is. You aren't taking a pill that floods your entire bloodstream.
No, you apply it directly to the affected tissue. These topicals bind immediately to those local estrogen receptors in the vulva and vagina.
And it actually works to rebuild.
The clinical data confirms it. This local application restores skin thickness, increases type I and type 3 collagen, and significantly thickens both the epidermal and dermal
That's
layers.
incredible.
And crucially, it achieves this with a minimal systemic absorption, meaning it rarely raises the estrogen levels in your general bloodstream to a degree that would cause systemic side effects.
So you're sending the maintenance crew only to the specific wing of the building that needs repair. But what if someone has a medical history that prevents them from using prescription estrogen, or they simply prefer an alternative? The source has dedicated a lot of space to phytoestrogens.
Yes, phytoestrogens are plant-derived compounds, such as genistein and daidzein, which are often extracted from soy.
Okay.
They possess a molecular structure similar enough to human estrogen that they can interact with our cellular receptors.
But wait, how can a plant compound trick a human receptor without causing the exact same systemic effects as human estrogen?
The mechanism relies on how they bind to the receptors. Genistein is particularly noteworthy because it acts as a natural SERM, a selective estrogen receptor modulator.
A selective modulator. So it doesn't just like turn everything on at once.
Like think of it like a master key that only fits specific locks. It binds with a much higher affinity to the ER beta receptor rather than the ER alpha receptor.
Oh, interesting.
And when genistein activates that specific pathway, research shows it upregulates TGF-beta, the signal that stimulates elastin, and it increases the local levels of TIMPs.
It reinstalls the brakes. It puts the brakes back on the MMP demolition crew without necessarily triggering other estrogenic pathways in the body.
You've got it. By elevating those TIMPs, the plant compound inhibits the destructive matrix metalloproteinases, effectively halting the accelerated degradation of the collagen and elastin you still have.
Okay, I have a logistical question about timing, though. Say someone is listening to this, and they've already experienced significant labial deflation. The fat pads have shrunk, the tissue feels paper thin. Is it too late to start applying a topical estrogen or a phytoestrogen?
That's a great question.
Like, can the biological mattress be fully reinflated?
The data points to a nuanced reality here. Topical estrogens are incredibly effective at reversing the thinning of the epithelial layer, restoring moisture, and improving local blood flow.
Okay, that's good.
However, they cannot magically conjure back the adipocytes, the fat cells of the labia majora, once they've been completely reabsorbed by the body.
Ah, I see.
A patient will regain tissue health, elasticity, and comfort, but the gross anatomical volume might not fully return to its premenopausal state.
So the timing of the intervention really dictates the structural outcome.
Yes, emerging clinical evidence strongly supports a prophylactic approach.
Meaning, starting early.
Exactly.
Hmm.
If a patient begins utilizing low-dose topical therapies around the perimenopausal period when estrogen is just beginning to fluctuate, but before the massive 80% drop occurs, they can preserve that dermal collagen before that initial 30% loss ever happens.
Wow.
It is entirely about maintaining the scaffolding before the demolition crew arrives on site.
Prophylactic vulvar care. Catching the chemical shift before the physical deflation takes hold. That makes total sense.
It really does.
Let's briefly recap this incredible biological journey we've been on today. We started with the master gardener, estrogen, dropping drastically during perimenopause. That sudden hormonal withdrawal fires the maintenance crew and unleashes MMP12, the demolition enzyme that aggressively chews through the dermal elastin in the vulvar skin.
And concurrently, that lack of estrogen signaling causes the fat cells in the labia majora to shrink or be reabsorbed. The combination of collagen loss, elastin destruction, and fat depletion results in the visible sagging, thinning, and deflation of the labia.
But by utilizing targeted topical estrogens or specific phytoestrogens like genistein, we can bind directly to those local receptors, put the brakes on the demolition crew, and signal the fibroblasts to start rebuilding the scaffolding.
Exactly. It is a completely biological process with biological solutions.
And as we wrap up our analysis, I know you had one more thing.
I do. I want to leave you with a final thought to ponder a really interesting thread from the research regarding the future of this fragile tissue.
Oh, I love pulling on these threads. What else did the researchers uncover?
Several of the histological papers briefly touched on the emerging field of mechanobiology.
Mechanobiology.
Yeah, they noted that mechanical strain, actual physical tension and movement, activates specific cellular signaling pathways in pelvic tissues, notably the PI3K/ACT pathway.
Mechanical strain, like the physical act of moving your body,
Yeah.
walking, exercising, or just the friction of clothing.
Exactly. When you walk, the physical pulling and stretching of the skin actually sends signals to your fibroblasts. The physical stretch tells the cells they are needed to provide structural support.
Oh, well.
So, if our estrogen-depleted vulvar tissues are losing their elastic bounce and their internal scaffolding, how does the simple act of walking interact with this newly fragile, altered cellular matrix over the next 20 or 30 years?
That is wild to think about. If the tissue is mechanically weaker, the very act of walking might be desperately trying to send emergency repair signals to cells that lack the estrogen required to even respond.
Precisely. We always conceptualize hormones acting in a chemical vacuum, but they're constantly interacting with gravity, with friction, and with our daily physical movements.
Right.
Does the sheer mechanical friction of our lives alter how these estrogen-depleted tissues remodel themselves post-menopause?
We are not just static buildings slowly decaying. We are living biological mattresses that are still being moved around, stretched, and lived in every single day.
Exactly.
The mechanical forces we subject our bodies to might matter just as much as the chemical signals we lose.
It is a highly dynamic, ongoing interaction between your internal biology and your external physical environment.
For everyone listening, I really hope this deep dive into the cellular mechanics gave you that aha moment. The next time you think about the structural changes of aging, remember the unseen scaffolding, the silent cellular maintenance crews, and the incredible complex biology happening beneath the surface of the skin.
It's empowering once you understand it.
It really is. Keep questioning the mechanics of your own body, keep learning, and we will see you on the next deep dive.